This report is a fresh new approach that really calls for a transformation of our healthcare system from a reactionary system to a proactive system. There are no sacred cows. It talks about 70% of the diet being ultra-processed. It talks about pesticides, microplastics, natural light exposure in children, sleep quality. Remember, Republican, Democrat, and independent moms showed up in high numbers to vote for President Trump over this very issue.
That's the new FDA commissioner, Dr. Marty Makary, on the new report from the Make America Healthy Again Commission. RFK Jr. has called the chronic diseases plaguing Americans an epidemic, especially among our children. The report finds likely causes of the crisis include an over-reliance on ultra-processed foods, exposure to food additives and pesticides, a lack of exercise, widespread chronic stress, and a growing dependence on prescriptions and vaccines. Let's bring in Fox News senior medical analyst, Dr. Marc Siegel. Dr. Siegel, I know you've taken a look at the report. What do you think about it?
I agree with Dr. Makary's statement that you just put up, that it's a reactive healthcare system. Here's how you tie it all together. Kids get sick, and then they end up on medications that they might not need otherwise if they were healthy to begin with. That's what he means by reactive. It's a sick care system with over 20%, over 1/5 of all kids obese right now. Now, how did they get there, John? They got there by being sedentary, where the majority of teens, for example, have less than an hour per day of activity. Used to be the whole day was activity, right? Sleep disturbance is a huge problem among our teens. Loneliness, anxiety, not eating right. Makary says 70% are eating ultra-processed foods. He's right about that, and the report puts that in there. But what do we mean by ultra-processed foods? We're talking about addiction to sugar, addiction to food coloring and additives, empty calories, stuff that's addictive. So it's hard to get off of this stuff, and you start to get used to it. Again, no sleep, stress, anxiety, eating poorly. And then once you have the obesity epidemic, once you're obese, you're at a high risk of things like diabetes, high blood pressure, things that I have to treat in the doctor's office. How am I supposed to treat this? I end up treating it with medications that kids might not otherwise need.
Well, that is one of the report findings from the Make America Healthy Again report, and I want to put them on screen for our viewers. Poor diet and ultra-processed foods you've touched on. More than one in 5 children over the age of 6 are considered obese. 1 in 31 diagnosed with autism, and then cancers spiked 40% since 1975. To what do you attribute that? That's an alarming rise in childhood cancers, doctor.
That's really terrible, and I think some of that is due to the obesity, lack of activity. Some of it is due to the stuff in their foods. Some of it is due to what's in the environment. 40,000 chemicals are in the environment. Another thing I like about the MAHA report is it's saying we have to do precision toxicology studies to figure out exactly what's in the environment that actually leads to poor health outcomes. It's also directly linked to attention deficit hyperactivity disorder. I mentioned anxiety and depression. Kids end up with anxiety, and we're talking about 10% of our kids are diagnosed with ADHD, and then they may end up on medications they don't need. So again, it's environmental chemicals combined with what's in the food, combined with sedentary behavior, high stress, not enough sleep.
A couple of states are taking steps to, try to improve the health, especially of their children, by banning soda and junk food through SNAP benefits, basically food stamps, as I understand it. Nebraska and Iowa, 2 good heartland states, are going to try that, and others are considering a ban. Those are the yellow states that you see there, from Montana down to Texas and over to West Virginia. What do you think about that move, doctor?
Including, by the way, in there, Iowa and Indiana. What I like about that move is I like it also with a slight word of caution. I like that Nebraska is doing it as a trial program. Here's the word of caution. I said the word addiction. When you eat this ultra-processed food, it changes brain chemicals. What are we going to replace it with? I think we need to incentivize those states, because 1 out of 5 children in these states, 1 out of 5 children on SNAP, John, are eating this food, are eating this ultra-processed food, and it's in the school lunches too. So we need to incentivize healthier food to replace it with more vegetables, more salads. Even in Arkansas, they have rotisserie chicken. That's certainly healthier than candy bars and soda. So we need to look carefully at what we're going to feed our kids. And by the way, once kids eat tastier food that's healthier for them, that's what they're going to get used to. That's what they're going to look for when they go to school.
It's a huge challenge, and let's hope we can get our hands around it. Dr. Marc Siegel, thank you.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.